Well, the COVID treatment Paxlovid was approved a year ago by Health Canada. But CTV News has learned that more than 100,000 treatments are unused in BC, even though patients are struggling for access. As CTV's Penny Daflos reports, our province is heavily restricting the medication that could help those most at risk.
Coughs, fever, and fatigue are impacting countless BC families right now, including the Dobells.
We've stayed very healthy, but this has really thrown me for a loop. I can hardly walk up the stairs.
Anne has been sick since Boxing Day, testing positive for COVID-19, and spoke with a doctor about the medication Paxlovid.
And I explained that I'm feeling very sick, that I'm 85 years old.
He said she's not eligible, and so neither she nor her husband, also sick with COVID, are able to get Paxlovid despite their age and serious symptoms because they're vaccinated with no serious medical issues.
Why would they do that?
Unlike other medications, there's lots of it. The federal government made it clear that after an initial shortage, supply of Paxlovid is no longer limited as of June. Now CTV News has learned a surplus of 30,000 doses last spring has ballooned. The federal government provided BC with nearly 150,000 treatment rounds last year, but only 18,000 patients have received approval, leaving 140,000 sitting on shelves.
There's a very narrow population of people for whom we can prescribe Paxlovid in BC. There are very strict criterions set by the BC CDC.
Doctors' hands are tied. Some patients are ineligible due to clashing medications. Unvaccinated COVID patients have easy access, but even sick seniors must have multiple health issues to qualify. And unlike the vast majority of medications, Paxlovid prescriptions still require a complex form and special approval in BC.
It was close to 30 minutes to go through the whole process.
Contrast that to Ontario, where even pharmacists now have the authority to prescribe it.
There are so many patients who don't have timely access to a family physician, either because they don't have one or because our family physicians are so overwhelmed.
I can't understand why Adrian Dix, the Minister of Health, does not allow British Columbians to be given this more readily.
So, Penny, why is it so much harder to get Paxlovid in BC compared to Ontario?
Mi-jung, I've been trying to ask Dr. Bonnie Henry about that today, but the Ministry of Health sent me a statement instead without explaining why they wouldn't let me speak with Henry or why BC is throttling access. It's particularly baffling considering we're seeing rising hospitalizations, mostly among seniors due to COVID-19, while there's 140,000 rounds of Paxlovid treatment just sitting in a warehouse somewhere. Mi-jung.
All right, thank you, Penny.